medical supplies. Call them at 949-6211. And Cayman Insurance Center, celebrating 45 years in the Cayman Islands, specializing in property, life, and other lines of insurance products and services. And Health City, now open at Camana Bay 7 days a week. Optical Outlook, now at their new location in Anderson Square. Come see the difference with Optical Outlook. And Lee's Office Products Limited, at Paddington Place, Godfrey Nixon Way, moving your business forward.
And now, Radio Cayman presents The Business Buzz, an insightful and fresh take on a variety of issues that impact the local business environment. This is where we address the business topics that matter. Radio Cayman's Business Buzz. Here's your host, Anita Khan.
Good morning and welcome to the Business Buzz. It's 18 minutes after 8 o'clock. This is our Thursday edition of the Business Buzz, and it's only one segment this morning, short segment, but it's a pleasure to have guests in the studio. I want to say good morning to Miss Susan. She's woman in the board this morning and camera and just about everything else. Good morning, Susan. Good morning to our listeners and our viewers on YouTube. I want to say thanks to Simon on Money Sense this morning. Great show, Simon, and it was very informative and interesting. Oh, Neil. Email, as Susan says, was email. I just assumed it was Simon. But it was a great show this morning. He's hoping you enjoyed it. And yeah, you'll enjoy our upcoming segment of the Business Buzz this morning. For all of you, please remember, practice your social distancing. Avoid large crowds, especially indoors. Wear your mask. And don't forget to wash or sanitize your hands and keep safe. Okay, this morning on the Business Buzz, we put the spotlight on your health, because your health deserves nothing less than the Royale treatment. And this morning we put the spotlight on Royale Medical Center. Our guests in the studio, I'll let them introduce themselves. The good doctor is sitting on my left. Good morning.
Good morning. Pleasure to be here. My name is Julia Irimia, and I am one of the new OB-GYNs in the practice, just joined.
Well, welcome.
Thank you very much.
And it's good to have you in the studio too, and you're new to the island as well.
Yes, I'm quite new to the island, so I've just arrived in mid-August, did my quarantine, and started working with Royale Medical and Wellness Center in September. So you could say that I'm fairly new to the island.
Fairly new. Well, double welcome.
Thank you very much one more time.
And welcome to the studio this morning, Mr. Kirk. Mr. Kirk
Donald.
Kirk.
K-I-R-K.
How are you, Mr. Kirk?
I'm doing very well.
You're no stranger to Radio Cayman.
And thank you for having us. Thank you very much. Good morning to our listeners. And this morning, Royal Medical will be I started introducing one of our new OB-GYN, Dr. Ermia. She will be going through, her profession and stuff that she will do and, what she bring to our clinic. Thank you for having us again, and Dr. Juliana will continue.
You're welcome. Dr. Irimia. I love that name. Ulia Irimia.
Yes.
I always mess up names, so I'm making sure I got yours right. Dr. Ulia Irimia, can you share a little bit on your professional background? And, of course, Kurt might want to jump in with the quality of service that is available at Royale Medical and Wellness Center.
So I am originally from Romania, where I was born, and also where I did my medical training. After finishing medical training there, I joined the training into obstetrics and gynecology, the specialist training, and I trained in Romania for 3 years. And after that, I have decided to further enhance my training, and I moved to Ireland to continue my specialist training in obstetrics and gynecology. I've been rotating to different hospitals in Ireland and passing all my membership exams, and finished the OB-GYN training in 2015. I'm also a member of the Royal College of Obstetricians and Gynecologists in the UK, and also a member of the Institute of Obstetrician and Gynecology in Ireland. For the last couple of years, I've been working as a consultant obstetrician and gynecology in west of Ireland. And although I really enjoyed my time spent there, I decided that it's time to take a new challenge and to accept the job with Royale Medical and Wellness Center. So I have just arrived on the island. And since I'm here, I really enjoyed my time.
And it's been a short time.
It's been a really short time so far, but really enjoyed.
So how did you find your way all the way over here? Not so far away. I mean, but I mean, how did that connection come about? I'm just curious.
Just curious. It's just that everything fell into place with the job, with my contract that was finishing in Ireland, and I decided that now it's the time to make the move to Cayman, and the job. I went to all those things with the work permit, everything. It's been ups and downs, but finally here. And as I said, really enjoyed being here, even if it's a short period of time.
Well, good to have you here. And I'm sure the ladies who are in their pregnancy stages will really appreciate your work.
Thank you.
No, Kurt, you might want to jump in here at some time. I keep calling you Kurt. And the
That's
quality of service that is available at Royale Medical Wellness you want to talk a little bit about that this morning?
Okay, so as everyone knows, Royal Medical and Wellness Center, as the name suggests, we have OB/GYN, we have rheumatologists, we have internal medicine, we have family medicine, and we have a full-fledged lab, which does, basically any request that any doctor will have. And it's and one of the things we pride ourselves of with the lab is our turnaround time. We have machines here that get results in a very fast time. So that is one of the things we pride ourselves on. And we usually open Monday to Saturday from 8 o'clock to 5. Saturday we tend to modify the time a little, so we close like about 3 o'clock on Saturdays. We used to open on Sundays, but after lockdown we decided to give the staff a break. So we are considering it again to open on Sunday. We just need to get the staff load to support. But Royal is apart from everything, it's a walk-in clinic. So we have urgent care, meaning, you can get whatever your case is, your situation is, you can call and we'll make an appointment for you right on the spot. We try to help as much as possible. So, I know there are times when people in financial difficulties, and we have been helping. We help a lot. We go in the community. We also help. We work with Lion Center, doing stuff for, people who need. We also work with Cancer Society, to help those unfortunate people who probably don't have, to help themselves. So Royal Medical is a place to go, is a place to call, is a place to, whatever your needs are. We are always here to help at any time.
And we've had some of your lovely doctors in the studio before. Mm-hmm. I want to say good morning to them if they're listening.
Yeah,
I know they're Radio Cayman fans. So, Dr. Ulia, let me ask you, can you elaborate a little bit on the obstetrics and gynecology services at Royale Medical and Wellness Center?
Of course. So we do provide care to women to their even before puberty. We have them to adulthood, pregnancy, antenatal, and postpartum care. We guide them to perimenopause. That's the period before menopause installs, and not at least we look after them in menopause as well. So we offer a really wide range of services at Royale Medical and Wellness Center.
Okay. Now, C-section. A lot of us don't, especially women who've had children before and had been through natural childbirth, don't pay much attention to cesarean section or C-section. Can you tell us what is a cesarean section or C-section?
So cesarean section is the most common, in fact, major abdominal surgery that is done in the world. It means that the baby is delivered to an incision onto the abdomen. And in fact, over the past decades, the incidence of cesarean section is rising, where we could have said that 30 years ago, the incidence was around 15% all over the world. In the last 10 to 20 years, it rose really, really steeply. So if we would look at high-income countries like UK and Ireland, the overall incidence of cesarean section is around 20 to 25%. And if we would take that compared to the US, where the cesarean section is 30%, so that means a quarter to a third of the women will deliver their babies by cesarean section. This can be either a planned cesarean section or either an emergency cesarean section for diverse motives. So it is quite common at this moment in time all over the world, and it's something that we struggle to make sure that women deliver the safest way. And in some instances, cesarean section is the safest way to deliver a baby.
Why do you think that there's a rise in those cesarean sections?
There is a lot of factors. There are loads of factors that rose to this steep climbing of the rate of the cesarean section. One of that factor is that it might be that that's the safest way to deliver the baby. So our methods of picking up fetal distress or methods of picking up fetal distress are better. So, and when we pick up something like that, we decide that the safest way to deliver the baby is by cesarean section. So we are much better at this moment in time of looking after women throughout their labor. And that's what happened because as a cause of that, we reduced our adverse outcomes by increasing the cesarean section. At the same time, I think people are not that skilled anymore to deliver babies vaginally, especially if they have complications or they would need instrumental deliveries like ventouse or forceps. Sometimes for some physicians, it's just easier to do a cesarean section rather than look after the woman throughout the labor and wait and have all the patients to deliver the baby vaginally. So I think it's just a combination of different factors.
Okay. Now, we're going to take a quick break, and when we come back, we'll ask you why are cesarean births carried out. But we've got to take a break and thank our sponsors. Our sponsors this morning, thank you, Cayman Insurance Center, Optical Outlook, and Cayman Medical Supplies.
2020. Unprecedented times, uncertainty, and literally a new way of life.
Life happens, usually without warning.
That is why making sure that your family is insured is so important.
Cayman Insurance Center, 47 years strong, working to protect your family and your most valuable assets.
Whether you need to get a quote, renew a policy, or file a claim, Cayman Insurance Center is here to protect you and your family.
For more information, call 949-4657. Cayman Insurance Center, specializing in property, life, health, motor, and other lines of insurance products and services at affordable rates.
Oh, Oh, gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies, free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery.
Open 9 a.m. to 5 p.m. Still delivering island-wide for your convenience.
Optical Outlook Caymanian Village location has moved. Same great services and products, new location. We've moved to Anderson Square in central Georgetown. It's a much larger space with dedicated parking. Please call us on 746-2020 to make your appointment at our new location today. Make sure to follow us on Facebook and Instagram. Please come see the difference with Optical Outlook, Cayman's premier optical provider.
The Department of Environmental Health would like to advise Boddentown residents of a vegetation debris collection from September 13th to 18th. Boddentown residents are asked to only place vegetation waste on the curbside where it is easily accessible to DEH collection crews. Do not obstruct the roadway or storm drains or place household trash. For more information on the Boddentown collection from September 13th to 18th, please contact DEH's Solid Waste Management Section at 949-6696.
Business Buzz. Business Buzz with your host, Anita Khan.
Welcome back to the Business Buzz. Good morning. If you're just joining us, don't forget you can, we're streaming live on YouTube, so you can also join us on YouTube this morning. And to all of you on the streets, don't forget it's a wet morning, so please stay safe. Now, in the studio, we have Dr. Ulia Iramia, and she's a OBGYN at Royale Medical Center and Wellness Medical Center and Wellness. And we have with her Mr. Kirk Donald. He is the owner of Royale Medical. Good morning again. Before the break, we were talking about cesarean section or C-section. Now, Dr. Iramia, why are cesareans carried out? You did allude to some reason why, but some more details.
So a cesarean section is carried out because of different factors. So sometimes, as I said before, the safest way to deliver a baby is by cesarean section, and there are some absolute contraindication to vaginal deliveries, and one of that absolute contraindication is if you would have problems with the placenta, like placenta previa, where the placenta covers the internal os. So that means that there's a very high risk of bleeding in that situation. So in that case, the safest way to deliver the baby would be by cesarean section. Other reasons that women might have a cesarean section might be due to fetal problems. For example, sometimes, and some babies might not tolerate labor, so their heart might go down, it might stay down, and that means that we need to act quickly, and that means that the safest and the fastest way to deliver a baby would be by cesarean section. One of the other reasons might be that the pelvis of the woman is not roomy enough to make the vaginal birth safe, and the pregnancy the labor might not progress, and you might get stuck at, let's say, 5 or 8 centimeters. And there are drugs that we can help with that, but sometimes it's just that you are stuck, and the baby gets into distress, and the safest way to deliver would be cesarean section as well. So there are multiple factors that might lead to cesarean section, and the least and not last is some women might be really, really anxious about having a vaginal delivery, and might ask for a cesarean section. So that's why it's really, really important us as obstetricians to guide them, to work with them, to answer all their questions and anxieties that might have, and to tell them that in fact vaginal delivery is a really, really safe option if you would compare it with a cesarean section. So there are multiple reasons for why women would have cesarean section.
Child rearing or childbearing is not an easy job, and neither is child rearing. So. But we're glad we have doctors like you, Dr. Irma, to take care of women in that stage, because my mom used to say, you know, it's life or death. You know, it's that point in your life where, you know, it's very scary. But because we have great doctors around the world that can take care of women in labor, we're comfortable.
Yeah, we said that safety is, we focused on safety. So if it is safest to deliver the baby by cesarean section, yeah, that's fair enough. But at the same time, most women will have a safe vaginal delivery without any complications.
Okay. Yeah, I was just saying off cue that my daughter is 36, and mine was a very hot induced labor. That's the reason I only have one child. It's still fresh in the memory. But how many C-sections can a woman have in her lifetime?
It depends. So there's not an absolute number of how many sections a woman can have. We would say that the more sections you would have, the higher the risk for further pregnancies from mother point of view and from baby point of view as well. I've seen women having 6, 7 cesarean section without any kind of problems, but at the same time, there are women that after only one section, they run into serious problem with the second one. So I think it just depends. There's not a number that you would say, oh, after this you can't have further babies, or we would advise against pregnancy. As I said, it just depends.
So take for instance, if you have a woman who can only have two delivery by cesarean, what would your advice be to them at that point?
I think it depends. Usually we would advise women who had one cesarean section to explore the options, meaning that if the first cesarean section was straightforward and there are no recurring factors in the next pregnancy, and if everything was fine, we would advise women that vaginal birth is a really safe option for delivery. So we would explain to them what are the risks and cons, the advantages and disadvantages of having either a vaginal delivery, a planned vaginal delivery. This is something that we would call a VBAC, versus an repeat elective cesarean section. With 2 previous cesarean sections, we would be a little bit more cautious, advising women regarding vaginal delivery. And after 3 cesarean section, we would advise to have a repeat elective cesarean section because of the risk of that scar that's on the womb that might rupture with further labor.
And you always cut the same?
Yeah,
scar?
Usually we would cut to the same incision, the skin incision, and the uterine incision. It's a transverse incision, so we would cut the same. So just imagine the more cuts you have and the more you stitch it back together, the higher the risk that might scar might not be intact with the next pregnancy. So there are risks.
Okay. Now, what are some important factors to take into account after a cesarean section?
Factors that you might take into account of the after a cesarean section in the next pregnancy. We would say that it is really important, first of all, why the first section was done in the first instance, because as I said, if it was done because the pelvis of the woman was not roomy enough, that means that most likely with the next delivery, we would advise the woman to have a repeat section because that's a recurring factor. If the cesarean section was done because the baby could not tolerate labor, and if everything was fine, we would explain to the women the risks and benefits of having a vaginal birth.
Okay. Now, we know that VBAC stands for vaginal birth after cesarean, and ERCS stands for elective or planned repeat cesarean section. Now, are there you did mention some of the risk, why some women opt to do a cesarean instead of a VBAC. Now, how are there other risks relating to a VBAC?
So there are a couple of risks associated with VBAC. This is what we would call the vaginal birth after cesarean section. But we would say that if you would compare it with an elective cesarean section, a vaginal birth is the safest. One of the risks that might be associated with vaginal birth after cesarean section might be that that scar that is on the uterus while the woman is in labor might rupture. Overall, that risk is really, really tiny. So we would say that less than 0.5%, so that means less than 1 woman in 200 women will have that risk. We would advise women to give birth in a safe place, in the hospital, where they are monitored all the time. And if there is any suspicion that something is not going as it's supposed to go during labor, we will proceed and do a cesarean section. Overall, we say that the chances of a woman to achieve a vaginal birth after one cesarean section is around 75%. So if you would look at that figure, that means that 3 in 4 women have a really high chance of achieving a vaginal delivery after one cesarean section. And that incidence even is higher if you would have a previous birth after a cesarean section. So that means that if you have one VBAC, with the next VBAC, you're really, really likely to achieve a vaginal birth. So that means 9 in 10 women will have that chance. And as I said, it's a really, really safe procedure, and compared with another major surgery, is the safest, and it has the lowest risks.
If you're just joining us, you're listening to the Business Buzz. We only have one segment today, and in the studio we have joining us Dr. Ulia Iremia at Royale Medical and Wellness Center, and joining her Mr. Kirk Donnell, and he is the owner of Royale Medical and Wellness Center. I have to make sure I say it Royale. It's not it's Royal, but it's Royale. All right, so Dr. Irma, let me ask you, what are some treatment options for fibroids? And can fibroids affect fertility?
So we would say that fibroids are really, really common. So what is basically a fibroid? So fibroid is a growth on the uterus, either inside the uterus, in the uterine cavity, or either outside the uterine cavity. And sometimes fibroids can range from a couple of centimeters to, let's say, 10, 20, 30 centimeters. They might not cause any problems at all. So, in fact, women with fibroids, they might not have symptoms at all. Mm-hmm. So that means that if they don't have symptoms, we shouldn't offer any treatment. Of course, fibroids can be associated with symptoms, meaning like heavy menstrual bleeding, or pressure symptoms, or abdominal pain. And we would offer those women treatment. We'd basically start from the simplest treatment to see if they work, and after that work with them depending on the severity of the symptoms, if the treatment worked or not. We would start, for example, let's take the example of, let's say, a woman has a fibroid, and her main complaint is heavy menstrual bleeding. One of the easiest treatment will be the medical treatment. So we would offer them some medicines to see if that sort out their symptoms. Of course, the main question that we have to ask ourselves is, what does the woman want? If the woman wants further babies, or if she's actively looking for fertility, it is a completely different treatment, for example, with someone who's not looking for fertility. In women looking for fertility, we tend to be less invasive. As I said, it depends a lot from their symptoms, and it depends if, for example, if they were trying to conceive for a long time, and we find out that they have a fibroid. It might be that that's the reason why they can't conceive. And most of the time, these fibroids are inside the womb, and we have really simple treatments to offer to them, like resection of that fibroid, and it's a really easy procedure that can be done as an outpatient setting. So it varies a lot, and it depends a lot of what the woman seeks.
Thank you for that, because I know a lot of women that do have, fibroids, and it's almost becoming as common as the as any other, any other health issues. We're going to take a quick break, and when we come back, we'll wrap up by finding out more about cervical screening, pap smear, and even menopause right here on the Business Buzz.
Optical Outlook Caymanian Village location has moved. Same great services and products, new location. We've moved to Anderson Square in central Georgetown. It's a much larger space with dedicated parking. Please call us on 746-2020 to make your appointment at our new location today. Make sure to follow us on Facebook and Instagram. Please come see the difference with Optical Outlook, Cayman's premier optical provider.
Oh gosh.
Don't let the stress of taking care of loved ones get you down.
Home care, now made easier with Cayman Medical Supplies. 100% Caymanian owned. Cayman Medical Supplies now stocks a wide range of home care supplies. Hospital beds, all types of wheelchairs, including beach access wheelchairs, lifts, commodes, shower chairs, walkers, Curad brand orthopedic supplies. Free blood glucose monitors with the purchase of 1 pack of test strips, blue underpads, and a whole lot more.
Need home care convenience? Drop by Cayman Medical Supplies at 93 Smith Road, Windward Center, or call 949-6211. Free delivery.
Open 9 a.m. to 5 p.m. Still delivering island-wide for your convenience.
2020. Unprecedented times, uncertainty, and literally a new way of life.
Life happens, usually without warning.
That is why making sure that your family is insured is so important.
Cayman Insurance Center, 47 years strong, working to protect your family and your most valuable assets.
Whether you need to get a quote, renew a policy, or file a claim, Cayman Insurance Center is here to protect you and your family.
For more information, call 949-4657. Cayman Insurance Center, specializing in property, life, health, motor, and other lines of insurance products and services at affordable rates.
Do you have plans to travel to the UK? You must provide a letter of certification from Public Health and your vaccination certificate issued in the Cayman Islands if traveling to the UK via the Bahamas, the United States, Canada, Jamaica, or any other Amber List country. If you are traveling directly to the UK from Cayman, no letter of certification is necessary. Letters of certification may be requested by emailing vaccinecertification@hsa.ky. Travelers must attach a copy of their vaccination card as a screenshot attached to their email request. All requests will take 3 business days to process, and letters will only be issued within 3 weeks of a person's date of travel. Letters of certification are only needed if traveling to the UK via any Amber List country. Travelers to the UK coming directly from the Cayman Islands do not require a letter of certification.
Business Buzz. Business Buzz with your host, Anita Khan.
Good morning and welcome back to the Business Buzz. We're speaking with Dr. Ulia Iremia of Royale Medical and Wellness Center, and also the owner, Mr. Kirk Donnell, of Royal Medical. Now, before the break, we were talking about fibroids. Now, let's jump into cervical screening. How important is that, Dr. Iremia?
So cervical screening is one of the most important things that a woman can do to reduce her risk of developing cervical cancer. In fact, we do know at this moment in time that cervical cancer is due to a virus, HPV virus. And in fact, we do have vaccines at this moment in time, and we're offering vaccines to prevent women developing cervical cancer later on in life. So I would say that it's paramount for all women to make sure that they're up to date with their pap smears, with their cervical screening, because cervical cancer is one of the cancers that we have something to prevent it. And we have a really good screening program in place that will pick up even changes before the cancer appears. This is something that we call precancerous cells. So it's really, really important for women to be up to date with their smear test.
How often should a woman have a pap smear done?
It depends. There are different guidelines. So we would say that if the smear test with HPV screening was negative, we'd advise them to have a repeat one in 3 years' time. And after menopause, every 5 years. Of course, if there were subtle changes or anything like that, that regimen needs to be changed.
Okay. So every 5 years
after menopause. After
Okay.
menopause, and we would say 3 years before menopause, if your previous pap smear was normal. So there's no need to do it every year if you have a normal smear test, because it's not going to show anything. So normal smear test every 3 years.
How early should women start having pap smears done?
Oh, that's a really, really good debate, and the guidelines vary completely. If you would look to the UK and Ireland, they would advise women to have their first HPV, only HPV screening now after the age of 25, because they say that HPV is quite prevalent in women less than 25, and most of them, they will clear it themselves. If you take the States, they would advise women to get their screening with the pap test early as 20.
20.
Yeah, 20. So it depends which guidelines you would follow.
No, for menopause, what symptoms should a woman look for as they head into that era?
So we would start first with the period before the menopause. So this is what we would call the perimenopause, and that can span up from a couple of months to a couple of years. And that's when women will start getting their periods more heavier or even more irregular. I think it just depends, and that can, as I said, span from a couple of months. Usually would say that a couple of years from age 45, the women might start experiencing symptoms. Also, there are the symptoms of night sweats, mood changes. So there are loads of different symptoms that women can experience. It's a normal state, and every woman will go to perimenopause and menopause. Sometimes some women will have lesser symptoms compared with some women that might find it that it intervenes with their life. And there are different options that we could offer, like treatment options or for the symptoms. Okay. So there are loads of things.
And at Royale Medical, we
will look after perimenopausal and menopausal symptoms.
All right. Having said that, Mr. Kirk, can you walk us through the process of registering and what your consultations consist of?
Okay. So first of all, if you need to get an appointment, you can call our number 769-6230. That's the front desk number. And I also have WhatsApp. You can send me a WhatsApp if you need registration for anything, which is 922-2119. Usually we have a very effective and system. You call, the receptionist will, get you in the system and book in an appointment, or she can put you onto the nurse, either one of the nurses, who will then, find the most appropriate time for you. So call us anytime, night or day. WhatsApp is anytime. In the middle of the night, if you need it, send it to me, and I will get it done the next day for you. The WhatsApp number is 922-2119. That goes directly to me. And the clinic number is 769-6230 for any appointment, anytime.
You have email?
And email is, you can send email to me, which is Kurt Donald at Royale, with an E, medical.ky. It can also go to info@royalmedical.ky or Royal Medical Center at gmail.com.
And you have a website.
And the website is www.royalmedical.ky.
And you have some very good COVID Q&A on there.
Right. And as things changes, we just had to implement the face mask as well. So, come in there, just prepare to wear your mask. And, if you don't have one, we will also provide one for you.
And your location, most of all?
Location is Baytown Plaza. That plaza with Kentucky along West Bay Road, or, everybody know the wharf is opposite the Wharf Restaurant. Same plaza with Cayman Island.
KFC?
KFC, right.
KFC. Okay. Now, let me jump back to Dr. Ulia. Dr. Ulia, before we let you go this morning, what has been the most satisfying thing about being a doctor and working in the medical field?
Oh, that's a really good question. I think that the most satisfying thing by being a doctor is making sure that we bring children to we can safely deliver children, and the gratitude of mothers that are really pleased with the service. So I think that's nothing can top that.
As an OBGYN, do you normally keep up with the children that you deliver?
Yeah, we would keep, and in fact, we have mothers that would come with their children age 1 to 5 years, and we keep up with them.
Okay. Now, what advice would you offer to someone who would like to get into the medical field, especially our young Caymanians?
I would say go for it. It is really hard work and loads of years into studying, and it's all the time you keep studying and keep trying to improve yourself, but it's definitely worth it at the end of the day when you come home and you're satisfied with the work that you did.
Dr. Julia Eremaya, thank you so much for being in the studio this morning.
Thank you very much for having me.
Welcome to Grand Cayman Islands. Welcome to Royale Medical and Wellness Center. And I'm pretty sure you'll have a wonderful time meeting the women of the residents of the Cayman Islands and working with them and delivering their babies.
Thank you very much for having me one more time.
Okay, thank Miss Susan. Susan is she does all the lead work and all of this.
Thank you, Susan.
And thanks to Mr. Kirk Donald, owner of Royale Medical and Wellness Center. Thanks to our listeners this morning, our viewers on YouTube, our sponsors, Cayman Insurance Center, Optical Outlook, and Cayman Medical Supplies. Thank you so much for your proud sponsorship of the Business Buzz. And for the rest of the folks out there, please stay safe, mask up, sanitize, wash your hand, keep your social distancing, and make sure you take care of each other. Okay, let's keep our safety protocols and our COVID protocols in place. Thank you. We'll see you on Tuesday, God's willing, for another Business Buzz.
The Business Buzz is proudly sponsored by Cayman Medical Supplies. Call them at 949-6211. And Cayman Insurance Center, celebrating 45 years in the Cayman Islands, specializing in property, life, and other lines of insurance products and services. And Health City, now open at Camana Bay 7 days a week. Optical Outlook, now at their new location in Anderson Square. Come see the difference with Optical Outlook. And Lee's Office Products Limited, at Paddington Place, Godfrey Nixon Way, moving your business forward.
Today's biggest news.
Radio Cayman. Your voice, your choice. Local, regional, international. This is Headlines from Radio Cayman.